The views expressed in this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Hello and welcome to another episode of Insights. I'm your host, Star Connor. In today's discussion, we'll be talking about the importance of breastfeeding and pumping while at work. My first guest is breastfeeding counselor Jessica Donakowski. I'm here with breastfeeding counselor Jessica Donakowski. How are you doing?
Great, how are you?
Good. Talking about encouraging women to breastfeed and pump here in Northeast Michigan, what are you doing here at the health department to encourage that?
Well, one is a breastfeeding peer counselor. I'm able to see moms prenatally and postpartum and educate them about the breastfeeding and the benefits of breastfeeding, some of the complications that they might have. We're able to assist them in achieving their goals, along with being a member of the Sunrise Side Breastfeeding Coalition, which is a joint collaboration between Mid-Michigan and District Health Department. Number 4, we're trying to bring more awareness to moms' breastfeeding rights, which also include, pumping at work.
Okay, and when you talk about pumping at work, there was a law passed that allows mothers to actually be able to take a break and pump their milk at work, right?
Yes, and on March 23rd of 2010, President Barack Obama passed the breastfeeding workplace law, which allows the mothers to breastfeed while they are working. An employer should allow a mom the proper amount of time to pump in a place that is other than a bathroom.
And that means anytime, anywhere, too.
Well, each employer has specific guidelines, so a mom that will be returning back to work will have to meet with her employer to speak to them in regards to certain break times that she'll be able to take a pump break, but she should not be denied the opportunity to pump or express or nurse a child while she is at work.
Now, as a breastfeeding counselor, what are some issues that you're finding with your own mothers, that are going back to work? Are they nervous about pumping their milk at work, or are they ready to go back in action and take action with this law that allows them to be able to pump?
I think within our local community and surrounding counties, the biggest problem that I see my moms facing is a reduced supply as they return back to work. They're not aware that they have the opportunity to pump while they are working.
You are a mother yourself.
Yes.
Did you breastfeed? Did you choose to breastfeed your child?
Yes, I did breastfeed my daughter.
Did you take breaks at work to do that?
Yep, I would pump every 2.5 to 3 hours and replace my feeding sessions with pumping so that I was able to provide her breast milk even while I was not with her.
Now, I'm still on mother because I'm not a mother yet.
Yeah.
But there's pros and cons to breastfeeding, and these mothers that are going back to work are going to, milk doesn't flow just on a schedule. Mm-hmm. I'm sure milk flows when it wants to flow. So will they be able to take these breaks on any occasion, or do they have to wait 15 minutes? Do they have to wait an hour to pump their milk, or how does it work?
Well, the way that the breastfeeding law works in the workplace is whenever a mom is feeling that she needs to pump, she should be allowed to. Typically, moms should be pumping every 2.5 to 3 hours. Most places of employment will provide mom with at least 2 15-minute breaks and a half-hour break, which is enough time for a mother to go express her breast milk.
There are some benefits to employers out there that allow mothers to pump their milk at work, right? Awards?
Yes. A Michigan Breastfeeding Network will actually award a place of employment that provides a breastfeeding room for mothers. There are different levels of the awards. These include the bronze, the silver, and gold. Once the place of employment has submitted their information to Michigan Breastfeeding Network, they will be awarded with a badge, social media advertising, and also tools to help keep their breastfeeding room going.
Okay, and I wanted to move over talking about pumping and breastfeeding. I know you as a counselor teach women how to breastfeed, of course, and pump their milk. So I did want to ask you, behind us is a actual pump.
Yes. In 2010, the Affordable Care Act passed that all insurances need to provide postpartum mothers with a breast pump. Mothers in our area can go get their Amita Purely Yours pump at Mid-Michigan Home Care. So this is a double electric breast pump where a mom can breast pump both of her breast at the same time while collecting milk. She can also choose to pump one side if she would like rather than both. There's different settings on here to help mom with expressing her breast milk. And again, this is completely free. All moms would have to do is just get a prescription from their OBGYN doctor and then take it over to Mid-Michigan Home Care and they will receive their pump. In addition to pumping and working, moms that may not receive a pump from their insurance can also, that qualify for WIC, can also receive a loan or double electric breast pump to help them continue maintaining their milk supply when they return to work.
And we're talking about the benefits of the child getting their mother's milk. And those are different areas of the baby's belly, I think you explained to me earlier.
Yes, these are the different stages of colostrum, or of breast milk. So the first stage we have here is colostrum, and this is the size of the infant's belly on the first day when they are born. It's about 5 to 7 milliliters, so very tiny, about a teaspoon. Oftentimes, I think parents believe that their infant's belly is about the size of this when they are first born, and this is completely incorrect. The next milk that we have is foremilk, and this is the size of an infant's belly on the third day, 22 to 27 milliliters, so it's about 4 teaspoons. And then again on the 7th to the 10th day, once our babies, after they are born, is about 1 ounce to 1.5 ounces. And the next milk we have is hind milk. So our foremilk is a very thin milk that is high in volume, and the hind milk is a really rich, thick milk that is low in volume. Moms produce all three of these milks within their breast, but for the colostrum is for the first 3 days, and then mom's milk will come in.
And as a mother yourself, or a mother out there in Northeast Michigan that is a little bit, hesitant of breastfeeding and pumping their milk, why do you want to encourage them to be able to, go out there in public and breastfeed their child, or, just find it encouraging to pump while at work?
Yes, and I believe so, because I feel that moms should not feel sheltered when they are nursing, that they are allowed to breastfeed anytime, anywhere within Michigan. And June 24th of 2014, Governor Rick Snyder passed a breastfeeding law where moms can breastfeed anytime, anywhere, an anti-discriminating law. Also, as a mother, I encountered many breastfeeding obstacles. It's important that moms are able to discuss their breastfeeding issues that they are having. They need to have the community that they need to know that the community that they live in supports them in their decision to breastfeed.
Well, thank you so much, Jessica, for your time today and so much knowledge on pumping and breastfeeding.
Thank you.
When we return, I'll be speaking with Mid-Michigan Medical Center Alpena's midwife, Bonnie Bartz. Welcome back to Insights. My second guest is Mid-Michigan Medical Center Alpena midwife, Bonnie Bartz. Today I have certified lactation nurse and midwife, Bonnie Bartz, here to talk a little bit about breastfeeding and some issues concerning that mothers cannot pump in the workplace. So with that concern, what do you think mothers are going to do with this law that they are allowed to breast pump at their workplace?
Well, hopefully they're going to use that information to just be aware that it is their right to pump or express breast milk at work. The federal law requires that women are given frequent breaks to pump or express milk so that they can maintain their milk supply for their baby.
Okay, as a counselor, what do you tell your mothers when they're breastfeeding? I know it brings a special bond between mother and baby. How is that beneficial?
Well, actually doing a lot of skin-to-skin time with the baby, especially the first hour after birth, establishes a very close bond between baby and mother. And the baby is going to recognize the mother's smell. She has a very unique smell in the colostrum, which is the early breast milk. It smells just like the amniotic fluid that they've been in for the last 9 months. So they recognize that smell and they're attracted to it. So doing that skin-to-skin time actually helps the baby be a better breastfeeder. And it also helps build the mom's milk supply. And then continuing to do skin-to-skin time throughout the first several months also is a great way to comfort a baby and again help maintain a milk supply.
And when mothers have babies, I understand that milk is constantly being produced. Why is it important for mothers to be allowed to pump no matter where they are?
That's very important to maintain the milk supply. Usually a baby will breastfeed about every 2 hours initially, and that continues for several months. It can vary. Sometimes during the night it can go up to every 4 hours. But what happens if the breast tissue doesn't get the stimulation of sucking or nursing every 2 hours, the mind starts to believe that it doesn't need that much milk. So it's really about a supply and demand situation. So if the mom starts spacing out the feedings to say, you know, I'm just going to go home and breastfeed on my lunch hour, and now it's been 4 to 5 hours since she's had any stimulation to the breast, the brain responds thinking, okay, I don't need to produce this much milk anymore because mom's only feeding every 4 hours. So therefore the milk supply just really dwindles.
And when you talk about milk supply, I was actually a child of a breastfeeding mother for 6 months. And I know that she did that because I was lactose intolerant. What are some other things that you're finding in a child that may need the supply of breast milk versus formula?
Well, first of all, we know for a solid fact that breast milk is by far superior to formula in almost every respect. It is the perfect nutrition for baby. It's the easiest to digest. It has just the exact amount of protein and fats and carbohydrates that the baby needs. Formula can sometimes be hard on a baby's gut to digest because it doesn't have the correct enzymes in it that you only find in breast milk. It tends to make, for the best baby healthy weight, sometimes formula contains too much fat and then you get overweight infant, in fact. And the other health benefits are huge. It can help prevent asthma. It tends to lead to an overall healthier baby with fewer ear infections, fewer colds. The colostrum, which is the early breast milk, which is for the first 2 to 3 days after birth, also contains a high number of antibodies, which means that as the baby digests these antibodies that were formed by the mother, it can inherit the mother's immunity to things like colds and flus and even pertussis and whooping cough, especially if the mother has received the whooping cough vaccine during her pregnancy.
Now, when we're talking about encouraging, I know there's some things in this office that actually we see a breast pump right here. Can you talk a little bit about that and what it actually does, like the training the hospital does for the mothers?
Sure. So this is a hospital-grade electric breast pump. Almost all insurances now do cover an electric breast pump for new moms. It does require a prescription from your provider, which we at this office are happy to provide. There's several different brands of breast pumps. This is an Amida, and the other brand that's very popular is Medela. But what these pumps do is they have attachments. They have hoses and then the cups that hook onto the mom's breasts for the pumping. But you can pump both breasts at the same time, and it generally takes 15 to 20 minutes to empty the breast. So it's relatively quick. You can do it in a quick break at work. But what this allows you to do is adjust your suction amount. You can turn that up and down. You can adjust the speed at which the suck is happening to most match what your baby's natural habit is. And you can set a timer so that you can even just not even pay attention to the fact that you're pumping. You could be reading or writing or doing other things except driving. Don't pump and drive. But you could set this timer at, say, 20 minutes, and then it would automatically just turn off when the 20 minutes is done. And then the milk that is stored in the bottles, you can just put a cap on it and put it in the refrigerator or the freezer. Breast milk can be stored in the freezer up to 6 months. Some sources even say a year. And milk can be kept in the refrigerator for about 3 days.
Okay. Now, do you believe that in the future breastfeeding and pumping at work will be more accepted?
I certainly hope so. And not just at work either. We have this little window cling here. This is a kind of a national movement called Breastfeed Anytime, Anywhere. And that's to make people in our community aware, like out at restaurants or the library or the car dealership or wherever a woman happens to be, that if her baby's hungry, she needs to feed her baby, and she has the right to breastfeed in public. So we're trying to make people aware that this is a normal and natural process. There couldn't be anything more natural than feeding your baby. And if you're breastfeeding, then you need to attach the baby to your breast and breastfeed. And it's certainly very doable. Most women either wear special clothing that kind of covers up the baby and the breast, or can just throw a blanket over top of the baby. But what we really want the community to be aware of is that you should not scoff at the mother or talk to her in a condescending manner, like, what are you doing, or why are you exposing your breast? That's illegal, because it is certainly not. It is very legal. And my reaction to seeing a breastfeeding woman in public is either just ignore her, let her go on about her business, or smile or give her a thumbs up, or just let her know that, hey, you're doing a great thing for your baby, so you should keep it up.
Well, thank you, Ms. Bartz, for your time and your knowledge on breastfeeding, and hopefully breastfeeding and pumping will be more accepted.
Thank you very much, Star, for having us on and talking about this very important issue.
Coming up on Insights, I'll be speaking to one mother who plans on using the breastfeeding pump law when she returns to work. Welcome back to Insights. In my third and final segment, we sat down with one mother who plans on using the pump at work law when she returns. I'm here with Alicia Mativier, and she is a mother of 2, going back to work, and you're going to be pumping at work, correct?
Yep.
Okay, and I see you have 2 sons, and why is it important that you are able to pump while at work?
Well, I wasn't able to breastfeed with my older son, and I'm doing really well so far with this one, so I want to be able to continue as long as I can to breastfeed him.
Okay, and how many weeks old is your baby?
He is 4 weeks old tomorrow.
Okay, and pumping is very important to a mother and a bond with their child. why do you find it in your heart that you want to, continue to pump and as long as you can when you do go back to work with him? Like you said, he's 4 weeks old now. So do you think that'll be 6 weeks or 6 months? How long do you think you're going to pump?
As long as I can, maybe a year even. I'm probably going to try for 6 months, and then if I can reach that, go farther. As long as I possibly can, I guess.
With the law allowing you to pump at work, do you find that very beneficial? Or would you say it's going to be accepted at work? Like, I guess, do you think that's going to be accepted at work?
Well, I work in preschool, so I help teach preschool. So I think it's very accepted where I work, because we work with kids. It's going to be a little interesting figuring out how I'm going to work it into the daily schedule, but I think it's great that there's the law there, so that way we can do it no matter what.
Do you plan on producing your milk and I guess like putting it in the refrigerator and freezer?
Yeah, I want to store as much as I can, so that way whoever's taking care of the baby has it to feed him, and that way when I stop producing, I'll still have some to feed him for a while yet.
And do you plan on taking as many breaks as you can at work to pump, or is there a certain amount of breaks they will allow you?
Well, the woman that I work with right now, she pumps and she does it twice a day, so I'll probably follow kind of the same schedule she does, because she seems to know what she's doing pretty well, so kind of follow her example.
If you had to speak to another mother who's out there and, you want to encourage them to pump at work, since you are allowed to, what would you tell them?
Well, I first tell them about the law, because I didn't know that there was even a law saying that they have to let you pump at work until they told me here. So I would definitely inform them about that and let them know that no matter what, they can do it at work. So that made me feel a lot more comfortable, just knowing that there's the law for it.
Okay, and to continue to breastfeed, you said you wanted to try up to a year. How do you think that's going to, what challenges do you think are going to happen with that?
Teething, for sure. I don't know, my sister breastfed for like 18 months, but she was a stay-at-home mom. So I don't know if it'll be different since I'll be pumping. I don't know, it's going to be challenging, that's for sure.
And how old are you?
I am 25.
Okay, as a 25-year-old, do you find it a little, probably because you're younger, you'll probably bounce back fast. Do you find it a little difficult or not difficult when you are pumping your milk? Because I know, like, my mother was a young mother, and I guess, like, age played a different role between the ages. Obviously, your oldest is 4. Mm-hmm. So do you think it'll be probably, like, a little easier since it's round 2 for you as a mother?
I think it's a little harder because my older one waits to need something until I'm in the middle of pumping or breastfeeding, it seems like. And it's also like, it would be nice if the pumps were all cordless so that you could do other things. You can't really do a whole lot while you're pumping or breastfeeding. I think that's one of the biggest challenges.
What type of pump are you using?
The one that I got with my insurance, it's Medela. I think it's called like an InStyle. It's a double pump. That's the one that I have right now.
Okay, so you're able to pump out of both breasts at the same time?
Yep, if I want to, or you can switch it to do just one at a time.
Okay. Do you know how long your job is going to allow you to pump? Is it going to be as long as like 30 minutes or lunch break time, or?
Well, I get a, I think 15 or 20 minute break every day, so I'd probably pump during that. And then I'd probably maybe take another 15 or 20 minute break during the day and pump then as well.
And while you're pumping, do you find yourself eating healthier too, or do you just eat what you want?
I definitely eat healthier because I know that the baby's getting what I'm getting, so I want my kids to eat healthy, of course. So.
And he's napping now. We got one napping and one on TV. Do you find are there any similarities between your sons, or do you find differences between them?
They definitely look similar. He is identical to what he looked like when he was born. So, and he has a lot of the same tendencies that he had when he was little. So I think there's definitely a lot of similarities.
Anything else that you want mothers out there who are pumping as well to know or encourage them to keep pumping or breastfeeding their child?
Just remember that the breast is best, as they say. It's what's healthiest, so just keep at it, even though it can be difficult.
Well, thank you, Alicia, for sharing your time and your boys with us on Insights.
Thank you.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.